American Back Centers. You've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Center.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening each and every week. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 a.m. from 9 to 10 in the morning. Of course, as always, if you are new to the show, again, welcome. In the first half hour or so of the show, we typically talk about all the wide variety of treatment options we offer all under one roof, of course, American Back Centers. As I talk about almost every week, we've been around for over 50 years now. It's going to be 50 years now. We should have a little celebration, actually. But Dr. Miskovich started this practice over 50 years ago, and it's been in the local Wexford, Cranberry area for all that time. We were just down the street, which is now an Ace Hardware store, the building that we were in. We moved down the street about 10, 11, 12 years ago, and we're at our new location. We've been there for that amount of time, across from formerly Atria's, now Ditka's restaurant, in the Stonewood Commons office complex, Building 2, Suite 100. So very centrally located. If you're coming up the Turnpike, you get off of the Cranberry exit, get onto Route 19, less than 3 miles south, right off of 103 Bradford Road in the Stonewood Commons office complex. If you're getting off, coming up 79 or 279, you get off at the Warrendale or Wexford exits, and we're less than a mile off of either of those exits, right in between the two exits. Again, very centrally located, such a growing area. We have a lot of people that ask us, we used to have an office out in Monroeville. It just didn't make sense to us because this area was such a centrally located position. Such a growing area, so much demand in this area, so we brought both of our VAC tables to the one central location. And we're very happy we did because it's a great location to be in. It continues to grow this area. Even in the last 15 years since I started with the practice, it's amazing how things have changed out here. So in the last 20 years, the American Back Centers has been known as Pittsburgh area's disc specialty center. We have people coming from all over the country. Definitely, every day, people coming from all over the tri-state area, Ohio, West Virginia, the state of New York. They will travel for a treatment that works. They will travel for a treatment that's backed by clinical research. We've had professional athletes. We've had actors in town filming movies that want to do VAC-D because they know VAC-D works. They started VAC-D somewhere else. They wanted to finish it because it was working for them, and they want to avoid back surgery. They want to avoid all these possible complications that can result with these possible procedures that in many cases are just symptomatic, namely epidurals, pain shots, pain medication, prescription pain meds, over-the-counter medication. In many cases, physical therapy alone, which we do at our office. We do therapy here, but physical therapy alone does not really address the disc itself and the cause of the problem, which is the compression on the spine. And we talk about that. We talk about how the compression can lead to degenerative disc disease, spinal stenosis, where that disc is pushed out and now narrowing the spinal canal or the holes in which the nerves come out of, foraminal stenosis, leading to sciatica, weakness, numbness, and tingling, foot drop. All of these symptoms that we see with these disc problems, herniated, bulging, extruded disc. Don't let a surgeon tell you, or even your primary care doctor tell you that you only have one option, which is what I call the gauntlet. And just a silly name for prescription pain meds, physical therapy. Then they send you to a pain clinic for pain shots, epidurals. When that doesn't work, in many cases only gives you temporary relief. Then they send you to a surgeon. The surgeon tells you to come back and see me, a reputable surgeon in my opinion, tells you to come back and see me when the pain is unbearable. Keep trying the pain shots and the physical therapy because in most cases he knows you're going to be back. And then you get the surgery, and then we talk about all the lack of success, the permanent complications that can result, scar tissue, infection, bleeding. But the simple fact when we talk about the surgery, they're just snipping off a piece of the disc, whether it's through the laser procedure, which coincidentally costs $20,000 to $40,000 out of pocket, through a scalpel, just snipping off a piece of the disc, the compression is not being addressed. So the bone spurs, the osteophytes, the loss of disc height, the desiccation of the disc still occurs. So it's only a matter of time till they have to go back in there and do another surgery. Or potentially a fusion surgery where they put the rods and screws in the back. And we all know the problems of that. When they fuse a segment, that does take care of the compression problem finally. But now the areas above and below have to compensate for that fixed segment that was supposed to move, meant to move, and now cannot move because it's fused. And that's not including the dangers of the rods and screws becoming loose inside your body and all the scar tissue infection, risk of infection and blood clot that can occur with any surgical procedure, but especially fusion, which is an extremely invasive procedure. So kind of like taking a link out of a chain, as I tell you each and every week on this show, the areas above and below have to compensate. So in many cases, when patients come into my office, they have one segment that's worse than the others. Maybe one segment that's extruded or herniated, and the segments above and below are bulged. Well, guess what? When they go in there and fuse that one segment, those areas that are bulging now have to compensate even more. So what do you think happens? Now they become herniations. Now they become protrusions. They become more severe. So guess what? They got to go back in and do another surgery. And we see this over and over and over, subsequent back surgeries, and it's a proven fact that each subsequent back surgery has a lower success rate than the previous and a higher rate of possible complication. So we've been helping people for the last 20 years avoid this with a patented FDA-approved procedure, a medical procedure called VAX-D. And it's the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. You hear a lot of people out there advertising their disc therapies, decompression, glorified traction devices. My doctor has a VAX-D. No, he does not have a VAX-D. And you have to make sure it's a VAX-D. And the VAX-D is the only device that's out there. It's been proven to do what it says it does. It's actually reduce the pressure within the disc. And I encourage you, do your own research before you pursue any treatment option. You will see this with VAX-D. VAX-D is one of a kind. And it wouldn't be around for all these years if it didn't work. And it's been around for over 20 years. We're one of the first facilities to institute VAX-D therapy, one of the most experienced facilities in the country because of this. And we've seen thousands of patients, and every day worldwide at over 300 facilities. There's hospitals, medical clinics, orthopedic surgeons in private practice, chiropractic physicians, physical therapists, using and seeing the results, the research with VAX-D in their offices. There's approximately 3,000. No other so-called disc treatment can come even close to that. 3,000 patients a day being treated with VAX-D therapy. So again, the proof is in the pudding, as I always say, with VAX-D, the research, the documentation, the many, many years of success. And yes, it's not a 20-year-old treatment. They have perfected and advanced their therapies, and we have the latest technology right here at the American Back Centers helping people with the latest VAX-D technology. Also, in the second half hour, if you are new to the show, we typically talk about a fitness or nutrition topic. Occasionally we'll have a guest on talking about what they do. A couple weeks ago we had Jay Miranda from Healthy Hemp Solutions talking about the hemp oil and the hemp cream, which we'll touch on briefly today. We also had Pam Stevens from Beamer talking about their device as well. This week, we're going to be talking about how to safeguard your bone health naturally. So if you're of osteoporotic age, you've been put on osteoporotic drug, we're going to be touching on that today, some of the potential side effects and some of the issues you may be looking into, natural ways to help safeguard your bone health, again, naturally. And it's a big issue these days, whether it's through diet, lifestyle. We have some supplement advice as well today, which we'll give to you. Last week we touched on the dangers of flip-flops, and we talked about how everyone wears them, and we actually talked about how to wean them in. So especially the people that live in our area of the woods, we have winter, and then we have spring and summer sometimes. The weather just changes dramatically, and people just throw on the flip-flops. So they talk about how to gradually wean them in. Only wear them a couple hours a day slowly if you have to wear them. Then also, I also touched on how you can actually get an orthotic arch support built into your flip-flops. So these are custom to your individual feet. And that's why we do the scan. We have a 3D scan of the feet that is done right here at the office. So you get a truly individualized correction. So you see some of these sandals at the store, they may have a little bit of arch support built in, but how is that specific to your individual problem? I've never, in my years of doing the scan, seen the exact same scan of two patients. Every patient's feet are a little bit different as far as the degree of arch loss or increase. And there's 3 different arches of the feet. A lot of people don't realize that. And they all have to be addressed. If not, especially if you're wearing those flip-flops, we talk about the risk of bunions, hammer toes, all of these, plantar fasciitis. All of these things can occur just for the sake of wearing these shoes. And the same thing we see with high heels in women. They look pretty. They're definitely not comfortable. At least flip-flops are comfortable in some aspects as far as summertime. And they really play havoc on your feet. So we touched on that last week. If you'd like a copy of that article, you can, if you don't have a computer or printer or access to our Facebook page, you can call our office. We'll send it to you free of charge. But we ask you, if you do, go on the computer, Macola.com, look for the dangers of flip-flops, or go to our Facebook page. Our Facebook page is American Back Centers Pittsburgh. Find the section with dangers of flip-flops. We put all the articles from the weeks that were almost the last year or so of the shows. We've been doing the radio shows, the articles we touch on the second half hour, whether it's fitness or nutrition. And it's on there. So you can just print it off right from the Facebook page, American Back Centers Pittsburgh. If you can take a second to like our page, we'd greatly appreciate it. It just takes a second to do that. You can follow us as well and get everything sent to your, what do they call that, your page, your Facebook page. I think it's called the news feed of your page. So it just comes along every week. Every time we post something related to the show, it's going to be right on that page as long as you like our page, on your page. So you'll get to read all the information on what we're talking about on the radio, the nutrition segment or fitness segment, each and every week right on your news feed, on your Facebook page. So just go to our Facebook page. You can like our page, follow us, and you'll get that access. Again, American Back Centers Pittsburgh. Today, again, we're going to be touching on how to safeguard your bone health naturally. So definitely stay tuned for that. In the next few weeks, we're going to be touching on the number of people suffering from osteoarthritis has doubled, why that has, and some of the natural options to help avoid osteoarthritis. But today, we're going to be talking about how to avoid osteoporosis. So definitely stay tuned for that in the second half hour of the show. And also visit our Facebook page, American Back Centers Pittsburgh, to download that article, print it out, and like our page. Okay, of course, at American Back Centers, we are not your typical chiropractic office. As I mentioned, since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, and degenerative disc disease. We've helped people for the last 20 years. We've been known as Pittsburgh area's disc specialty center. So if you know someone who's suffering with a disc problem, patients may not even know they have a disc problem. They don't have an MRI confirming it. They may have back pain extending down their leg, hip, buttocks, groin, numbness and tingling, weakness in their legs, foot drop. You may need an MRI. You can come and see us. If we feel there's medical necessity, we can write your prescription. We get the MRI to confirm, because, again, the only way you're going to know, you can't see the soft tissue of a disc on an X-ray. You can see indications of loss of height of the space where the disc resides, which is an indication of compression on the spine and possible disc bulge or herniation, but you can only confirm it as a fact if you do an MRI and showing the disc bulge, herniation, degenerative disc disease, and such. And we can do that for you. So, again, we have the experience with that. We've been doing this for over 20 years here at the office, and we have the best treatment options for that, namely the VAX-D. As I mentioned, VAX-D is used in over 300 facilities worldwide, hospitals, medical clinics, orthopedic surgeons in private practice use VAX-D, chiropractic physicians and physical therapists worldwide. approximately 3,000 patients a day are being treated. No other disc treatment can make that claim, even come close to that. And you see a lot of people out there advertising on TV, radio, their disc treatment does this, it does that, they have the best disc treatment. But again, look at the research. You'll see the documentation. VAXD, again, is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. It's been used for the last 20 years with great success. Athletes in the NBA, NFL, NBA, Tracy McGrady, Mario Lemieux, the list goes on and on and on of people that have succeeded and avoided back surgery with VAXD therapy. We even had, I told you, Forrest Whitaker was here a couple years ago, famous actor in many, many movies. Again, not to see me, but he was here to get the VAXD therapy. And he did well with it. He had a very physically demanding role when he was filming that movie Southpaw. And despite that, his back did exceptionally well because he came and got his treatments. And he did what we said, we told him to do, and that's why he did well. So VAXD is used worldwide, as we mentioned. We also mentioned that VAXD is an extremely effective treatment for these disabling low back issues. People that have had, if you want to avoid surgery, you've already had a surgery, multiple failed back surgeries, we can still help you with VAXD in many cases. When you come in for the consultation, we'll sit down with you and determine that. There are a few contraindications, but in most cases, even if you've had back surgery, we definitely can help you. Of course, each subsequent surgical procedure has a lower success rate. So the question would be, why would you even want to go back for a second or third back surgery when the first one didn't work, knowing that each subsequent procedure has an even lower success rate than the first, and the first has a dismal success rate. So if your symptoms are radiating into your hip, your buttocks, your groin, down your leg, numbness and tingling weakness, you may want to give us a call and see if we can help you. And if you don't have an MRI confirming a disc problem, we can do that. And you may have a disc problem with those symptoms, and we want to confirm that. And you want to nip it in the bud. You don't want to let things go, because the longer you let things go, the lesser your prognosis is. It's not to say, even if you've had this problem for many years, you've been every doctor known to man, we've helped people in those situations. It's common sense that your prognosis would be slightly better if you catch the disease, if you want to call it a disease, in the early stages as opposed to the more complicated later stages. And VAXD is very effective in all stages, but of course the success rate is going to be slightly higher if we're catching it earlier on. Stats show a 92% success rate if VAXD starts within 30 days to give you a disc problem. And even in the most difficult cases, nationwide, a documented 75% success rate, even in cases that are 40 months or older. So even in the most difficult cases, there's still a much higher success rate. And this is a true success rate. I hear people out there advertising 98% success rate. It's artificially inflated. Whether you help a patient for a month, even a year, that's not true success. We're talking about permanent correction where the patient's 4 or 5 years plus are still pain-free. So no one truly can even come close to those success rates, 75% and 92% within 30 days, and 40 months and older cases. These complicated cases, people have been to every doctor known to man. 75% of the time, if not more, we can help them and get them out of pain, not temporarily, like some of these other treatments, and they don't tell you that, permanently, out of pain, and no longer have problems. As long as you follow the VAXD protocols, which is unique to our office. We also have a rehab program, which we institute as well. And as long as you follow the program, like we tell you, those success rates are tried and true. So we are doctors, over 300 doctors, 300 facilities worldwide, and we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. So as always, don't wait until your condition worsens. Call us today, toll-free, to schedule your free consultation, 1-888-222-8293. Again, it's not 1-800, it's 1-888-222-8293, or 724-935-3300. 724-935-3300 are the two numbers that you can call to schedule your free consultation. Also, you can fax over reports, MRI, CT, X-ray reports. Just remember where you had it done, call that facility, and then give them our fax number. and they can do the work for you in many cases. Our fax number is 724-935-3321, 724-935-3321. Again, that's the fax number. You can also schedule an appointment or request an appointment on the website, www.AmericanBack, B-A-C-K, B as in boy, A-C-K, centers, with an S, .com, www.AmericanBackCenters.com. You can request an appointment on the website. There's some great sections on VaxD therapy, how it works, some of the questions you may have about VaxD, some of the other services, which we'll outline here in a few moments, that we offer all under one roof right here at American Back Centers. There's a blog and patient education section. I encourage you to visit that. Under that, you can sign up for a daily health update newsletter. It's a free newsletter that has great health tips that's sent to your email when you sign up, free of charge. There's an inspirational quote for the day on there as well. So it's a great way to start off each and every day with an inspirational quote and health tips, free of charge. Also, you automatically get signed up free of charge for our monthly In Good Hands newsletter. This is coming from health minds all over the country. Contribute to this once a month. It's about 10 pages, and you automatically get this free, again, when you sign up for the daily health update newsletter. So definitely do that today. You'll receive all that free of charge. You can see our Meet the Doctors and Staff section, testimonials. We have so many testimonials that we need to add to this section, but we have quite a few on there now. Contact information, and of course, as I mentioned, you can request an appointment right on the website, American Back Centers, www.AmericanBackCenters.com. That's AmericanBackCenters.com. We are Pittsburgh's premier spine and disc specialists, and we've been offering this for over 20 years right here at the American Back Centers. We are open Monday, Tuesday, Thursday, Friday, and it used to be 9 to 7 each of those days, but on Friday we switch it to 7 to 5. So now we come in at 7 in the morning on Friday, and we close a little bit early on 5 o'clock on Friday. So 9 to 7 Monday, Tuesday, Thursday. Friday is 7 a.m. to 5. And Wednesday and Saturday is by appointment only, and we do not come in at all on Sunday. So those are our office hours. You can see those on the website as well. In addition to the VaxD, we talked about some of the other services we offer here all under one roof. We also offer a disc treatment option for the neck region. So if you're contemplating neck surgery, you've already had neck surgery, it hasn't worked for you, you have a disc problem in the neck region, degenerative disc disease, posterior facet syndrome, as I mentioned, failed neck surgery. We have an excellent procedure for that. We've helped people for years with this procedure. So if you know someone or you yourself have these type of disc issues in the neck, we also have the option with that as well, with that procedure. We also have therapy and rehab, state-of-the-art facilities, individualized programs, whether it's for the shoulder, neck, back, knee, ankle, foot. We have structured rehab programs for each area. Wrist, hand, finger, foot, ankle, and knee problems, tendonitis, rotator cuff, carpal tunnel, frozen shoulder, tennis elbow, golfer's elbow. The list goes on and on and on. Any musculoskeletal issue we can assess through adjustments, chiropractic, nutrition, massage, and therapy and rehab, all under one roof. We have a great massage therapist instituting deep tissue massage. He institutes myofascial trigger point therapy, acupressure, and reflexology right here at the American Back Center. We have comprehensive nutritional consultations that we offer here as well. Custom-made orthotics, as I mentioned last week with the flip-flops. You can get the orthotic built right into the flip-flop. I always recommend you to get the standard full-length orthotic first because you can put that in basically any shoe, with the exception of heeled shoes and sandals. But if you must wear the flip-flops, then you can get the orthotic, which I did, because I like to wear them from time to time, the orthotic built into the flip-flops so you minimize the damage that can be done when you're wearing the flip-flops by wearing that custom orthotic right in your flip-flop. So we offer that in our office, and you can learn more about how to get them made right into your flip-flop. They're inexpensive, and they're custom to your individual foot. Same thing with the orthotic itself that goes into any shoe, or 90% of shoes. And We scan them with a 3D scanner. It's much more accurate than the old casting kits. It takes about 5 to 7 business days to return to our office, and it's truly custom. It's not off the shelf. It's truly custom to your individual foot. Patients love these, and it truly makes a difference in their overall picture. In-house x-rays, we do the x-rays right here in the office if we need that. If you need an x-ray, nerve conduction, ultrasound testing, we have an outside facility that comes in and does that for us. If you need nerve conduction tests or ultrasound testing. And we have a convenient MRI facility located right across the street from our office. If you need an MRI, we can send you right across the street, CT scan, right across the street at North Pittsburgh Imaging. Certified personal trainer, so I can help you get back in the gym and do things correctly. It's very important because many people end up hurting themselves. They have good intentions to go in the gym, but they end up hurting themselves in the process. So again, VaxD is successful in approximately 75% of cases nationwide. Our success rate in many of the more experienced facilities is over 92% because of our experience in the many years we've been doing it, over 20 years now. Our protocols are physician-directed. Our protocols engages other modalities as needed on a case-by-case basis. We have unique protocols here. We continue to perfect what we do here. Nobody does it exactly like we do it here. And with that, our success rate is very high. And again, I cannot overstress this. Success is when you get a patient out of pain permanently, so they don't have the pain returning. And it's not success where patient's out of pain for a month or a year, which many people claim 98% success rate, but is that for a week or a year or less? When we say 92%, we mean the patient is out of pain and it's a permanent correction, not temporary. That's important to note. We have over 20 years of experience, one of the most experienced facilities in the country instituting this type of care. We screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we cannot help you, we're going to tell you, unfortunately, we can't, and we'll refer you out to the appropriate specialist. Again, if we can't help you, we definitely will tell you. So a little bit more about VaxD. Of course, the VaxD table and its computer, as I mentioned, almost every week work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure. So we're actually reducing the pressure within the disc, creating that negative pressure. Unlike these traction devices, decompression devices, there's proof. Again, Dr. Ramos and Martin, two neurosurgeons. This was published in the Journal of Neurosurgery way back in 1994, showing that VaxD, and again, no one has replicated this research. No other device, only VaxD, proving that negative pressures, upwards of a negative 200 millimeters of mercury, is produced each and every time you undergo the therapy. And this was done on real live subjects with pressure monitors, showing that pressure is reduced, negative pressure, and that's how we relieve that compression. That's how we structurally open up the disc. You can see the before and after pictures of a herniated disc, a compressed disc space. The disc is black. The disc is bulging, herniated out. The space between the vertebrae is diminished. And then after VaxD, you see the space opened up. You see the fluid, the white, return to the disc. And we see the disc material push back where it should be, off the nerve, out of the canal. So again, the proof is in the pudding. Again, you see it in the before and after MRIs of the many, many patients receiving VaxD. So it's not a gimmick. It's not a joke. It's not something we're making up. This is backed by clinical research, and you see the before and after pictures, the testimonials, the many, many thousands of testimonials of people that have received this wonderful therapy called VaxD. So VaxD is used by all specialties, as I mentioned, medical doctors, orthopedic surgeons, physical therapists, chiropractic physicians, not by just a few. And we see that with these other so-called disc treatments out there. And you have to wonder, why are not all specialties accepting this? Why aren't medical doctors, orthopedic surgeons, physical therapists using these procedures if they supposedly work so well? Why is only a few facilities? Maybe they only have 3 facilities across the country. Maybe they just have a few doctors using this procedure. VaxD has over 300 facilities worldwide, 3,000 patients a day. You have to question why so many people using this procedure. It must work, as opposed to these other so-called procedures. These tables trying to mimic VaxD. In many cases, these doctors are used car salesmen. They use these tactics to get you in the door not really telling you what the procedure is and trying to hide a lot of things from you. And that should put up a lot of red flags. With VaxD, you know it's VaxD. From the second you call our office, you know it's a VaxD treatment. And you can do your research. We encourage you, go on the Internet and do the research on VaxD, and you will see that VaxD, again, is one of a kind. It's a patented procedure. It's a high-tech computer, which never allows the paraspinal muscles to contract, which is so important and unique to VaxD, allowing for true disc decompression. VaxD is covered by workers' comp system and PA and auto cases. Many insurance companies do cover VaxD. If there is any out-of-pocket expense whatsoever, we will tell you. If there's any deductible copay, we will tell you. But, of course, workers' comp, if you're hurt at work or auto accident, fully covers the VaxD in the state of Pennsylvania. So if you have a workers' comp issue, call us today. We can see if we can help you. If you've lifted something at work, you have a disc problem. If you think you may have a disc problem and you need to get the MRI, in many cases, the workers' comp doctors are hesitant to order an MRI because now if you get a diagnosis of a disc problem, all of a sudden it becomes a bigger issue, and it's more time off of work in some cases. And their goal is to get you back to work as soon as possible and get you off the workers' comp payroll as soon as possible so they don't have to pay workers' comp. So those are issues as well. So if you're in that situation, call us. We can order an MRI for you. Workers' comp case, if you know someone that's been hurt at work, tell them to give us a call. We've helped many people with workers' comp. It is covered 100% through workers' comp. Auto cases, if you've been hurt in a car accident, hit in the back, it may be a jar your neck or your back. You may have a disc problem in the neck region or the low back. You may think you do. You may have pain going down your arm, down your leg. The only way we can confirm this is by coming in and doing an exam, consultation, an evaluation, possibly ordering x-rays or MRI, and then determining. So, again, this is all covered by workers' comp, auto insurance here in the state of Pennsylvania, as well as many neighboring states as well. So, yes, it is covered by your insurance in those aspects. And if there is any out-of-pocket expense with private insurance, we will tell you on all those things when you come in. So when you come in, it's a free consultation. You give your insurance card to my front desk person. She verifies everything for you before we propose any type of treatment program. If we decide you are a candidate, all that information will be given to you before we propose any treatment program whatsoever. So, again, the only way you're going to know if we can help you is by coming in and scheduling a free consultation. You can do it online on our webpage, www.americanbackcenters.com. You can request an appointment. You can call our office, toll-free, 1-888-222-8293 or 724-935-3300. Come in. We encourage you to bring somebody in with you, friend, family member, spouse. It's always helpful to have somebody drive you out here if you're in pain, of course. And if not, that's okay. We sit down with you, answer all your questions, do a detailed history, physical exam, and then determine if you're a candidate for the VaxD, the cervical, if you have a neck disc problem in the neck region, the neck treatment for the disc, as well as any of the other treatment options we offer here, all under one roof here at the American Back Centers, whether it's you're coming in for a massage, physical therapy, if you're coming in for the nutritional consultation, if you're coming in to get the custom-made orthotics, even if you're coming in for the lipo-light procedure, you come in for a consultation. It's a free consultation. We also offer for the VaxD a 24-page Keller booklet describing the VaxD in and out. You can call us today, and we can send it out to you free of charge. Of course, you can visit our website and see some of the similar information, but the booklet's a little bit different. Some different information is in the booklet. We also have a free DVD. This is when Channel 11 WPXI did a medical breakthroughs report on our office. We're very proud of this. They put us on Channel 11 News. They heard about all of the success we had helping people avoid back surgery. People have already had back surgery, helping them avoid another back surgery with VaxD, and we were put on Channel 11 News. So this is a free DVD. You can get it by calling our office, asking for the information. We'll send out our typical informational packet. Also, when you're calling for a consultation, we can also send you out the information as well after you schedule a consultation. Just ask for the informational packet, and we can send it to you, or you can pick it up when you come in for your consultation. We also have research papers we typically send out. We talk about those each and every week on the show. We have the Blue Workers' Comp booklet and the yellow auto accident booklet. So if you've been hurt at work, get this blue booklet. It tells you your rights as an injured worker. Many people are taken advantage of by the workers' comp system, as I talk about on the show each and every week. Don't let that be you or one of your friends, neighbors, or relatives. So many people are told a lot of falsehoods about what they can and cannot do. If you know the workers' comp system, the insurance companies, the employers want to get you back to work as soon as possible. In many cases, they don't care. They just want to get you back to work and get you off the workers' compensation insurance payroll, so they don't have to pay workers' comp. So this booklet shows you your rights. I encourage you to call and get this booklet. It's free. We also have a yellow auto accident booklet showing the rights of a injured auto accident, personal injury person as well. These are both done by attorneys, so they're great books, and they are totally free. All right, so we're going to get into a quick testimonial here, and it talks about a patient that received VaxD. She goes on to state, we have many, many more testimonials on our website, www.American Back Centers Pittsburgh, so I encourage you to visit that and see the many more testimonials we have. But she goes on to state, her name is Linda. Before VaxD, I spent 6 months in a back brace that I needed special clothes for. I had a lot of difficulty walking because of my back pain. As a result, I had to give up a lot of my activities I enjoyed. I was told by my physician that my only option that I had to get rid of my back pain was surgery. Then I found VaxD, thankfully. I started VaxD treatment centers. I started VaxD treatment at a VaxD center in Pittsburgh. I had 20 sessions for about a month, following all their instructions religiously in order to get the best results of the procedure. I'm happy to say it's been over a year since I completed VaxD. My back pain is still gone. I feel like a normal person again. I can now walk my dog. I can get up after a train ride as well as out of bed every morning without any pain. Even with these results, I remain realistic that I am no longer 20 years old and I cannot partake in everything I once did. Nevertheless, VaxD has taken away my fear that I once had of performing my everyday activities, and I can do them pain-free now. Simply put, it gave my life back. This is from a Linda who received VaxD therapy. And just one of the many testimonials VaxD has seen over the years. Of course, we talk about the National Institutes of Health state 9 out of 10 back surgeries are not successful or effective. British Medical Journal, American Medical Association state lumbar disc surgery is ineffective, not successful. We see this over and over and over. Higher rate of complications with more downside. Back surgery is a permanent procedure with possible permanent complications. We talk about the lack of success, talk about the options, the hype debunked section that I found from a surgical website. This is a surgeon talking about comparing the different types of surgeries. Laser spine surgery is a misleading language, he goes on to state, used in promotional material from other centers, when in fact it's a very traumatic operation. Laser spinal surgery, very traumatic operation. This is coming from a surgeon, requiring a sizable opening, stretching and tearing muscle, drilling and cutting out of bone, ligament, and commonly joint as well. This bone, ligament, and joint removed is typically completely normal and doing an important job in the spine. Removing this causes permanent damage and permanent symptoms due to this damage, hence failed back surgery syndrome, scar tissue, and such. This laser procedure, as I mentioned, costs $20,000 to $40,000 out of pocket. They claim it to be 98% successful. And my question is it for 1 week, 1 day that you have the pain relief? Because all they're doing is snipping off pieces of disc, very similar to what they're doing with a scalpel. And most surgeons will tell you the scalpel is more accurate because they know how far they're going in. They're more precise because they're using their own hands. And it's basically the same thing. And it's still a very sizable opening. They're still ripping out ligament, bone, and tissue. They don't tell you that. And the success rate may be for a day, a week, at most a year, and then the pain comes back, and then guess what? You got to go in and do more surgeries in most cases. But they don't tell you that after you spent $20,000 to $40,000 out of pocket. Again, this is coming from a surgeon's website, talking about and comparing the hype debunk with surgical procedures. They talk about minimally invasive spinal surgery. This is what every spinal surgeon claims to do. Exactly how small is it? Most so-called minimally invasive spinal surgery is actually a very traumatic and damaging procedure. The problem is that the words minimally invasive mean something different to each person using the words. Is it bigger than your fingernail? Smaller than your fist? There's no specific or standard meaning to the term minimally invasive spinal surgery. And they don't tell you that. And again, this is coming from a surgeon. And over, when we talk about the fusion surgery, and we have that research paper we send out, Knife in the Back, showing the dangers of fusion surgery and why it continues to be a money-making procedure for hospitals and clinics worldwide, because they make a tremendous amount of money doing it. Even though it's a very invasive procedure, high rate of complication, and very low success rate. We talk about the areas above and below. In many cases, when they fuse one segment, the worst segment, the areas above and below that are already suffering, just get worse. And then guess what? You got to go back in for another surgical procedure. So when we talk about VAX-D, again, VAX-D has many research studies showing that it is unique when we compare it to these other so-called disc treatments out there. There's a textbook called The Practice of Minimally Invasive Spinal Technique. This is a medical textbook. It goes on to state VAX-D should not be considered traction in the traditional sense, but as decompression. VAX-D is the only non-invasive treatment that has been proven to decompress the disc. With other traction devices, there's only been indirect proof. So VAX-D has the real science and the real studies. VAX-D has many, many studies published in peer-reviewed medical journals proving the effectiveness of our procedure. And we've been doing it again for over 20 years right here at the American Back Centers. VAX-D's exclusive logarithmic curve is the key to bypassing the guarding effect that you see typically with these inversion tables, traction tables, decompression devices. VAX-D has a patented procedure that, again, is used in over 300 facilities worldwide. 3,000 patients a day are being treated with VAX-D therapy. There's a quote from Dr. Cheney, medical doctor who's the former Assistant Surgeon General of the United States. Goes on to state, I believe anyone with a herniated disc or degenerative disc should try VAX-D first before surgery. Again, this is from Robert Cheney, MD, former Assistant Surgeon General of the United States. So very, very reputable testimonial from a very reputable person. So the real question should always be, why would you even think about surgery with all its complications and lack of success, not including the normal risk, including infection, bleeding, scar tissue, blood clots that can result in death in many cases, when VAX-D is an option? Remember, VAX-D is a non-invasive procedure, a very safe procedure with a much, much higher success rate than surgery, pain injections, physical therapy, many other conventional treatment options. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, VAX-D addresses the true cause, the structural cause of the problem, not just the symptoms, decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, truly relieving your pain associated with the cause of the problem. Low back pain, disc problems, herniated, degenerated, extruded, bulged, sciatica, stenosis, numbness and tingling, foot drop, and as I mentioned, even failed back surgery cases. All right, quickly, we're going to get into our nutrition segment today. I do like to highlight some of our products. I'm just going to highlight a few today. We have a real nice product for allergies. If you're suffering from environmental allergies, especially this time of year as we get into the fall months, as we're getting into them slowly because the weather is definitely cooling down a bit, you're going to see the ragweed come out, the goldenrod. If you're allergic to that, you may want to try our allergy product. We have a great product that works exceptionally well for seasonal allergies. It's a great alternative to the prescription and over-the-counter remedies for allergies. Just call our office and ask about the allergy formula. We could send it to you, or you can pick it up right here at our office. We also have a great product for sleeping. Natural Calm has their Natural Calm Calmful Sleep product that has all the main ingredients, including magnesium, GABA, L-theanine, and melatonin, which are great products for helping for a restful and sound sleep. Wonderful, wonderful product. I highly recommend it. It's completely natural, vegan, gluten-free, GMO-free, no dairy, egg, soy, wheat, sugar, fructose, starch, preservatives, artificial colors, or flavoring at all in this product. Great, great product, Natural Calm, Calmful Sleep. We also touched on the probiotic. We have a great probiotic. It's called the ABC Premier Probiotics. 50 billion CFUs per vegetable capsule. When they make them, there's 100, and the 50 billion is based on the expiration. So a lot of people make claims of 40 billion, 20 billion, but they don't tell you that's how much was in there when they made it. When we put it on the label, 50 billion, that's how much will be in there even when the product expires. So it starts with 100 and finishes with 50. So wonderful, wonderful product, high potency. We talk about the importance of probiotics. I believe everyone should be on a probiotic for your immune system health as well as overall health. We talk about the issues with leaky gut. You know what leaky gut is, as well as overall stomach and intestinal health. A probiotic, and a great probiotic, a high-potency probiotic like this one, is the way to get started. And I recommend everybody try a product such as this. If you'd like to try it, call our office. We can send it to you. ABC Premier Biotic, 50 billion, even at expiration date, CFU per vegetable capsule. It's a 4-strand probiotic, totaling, again, 50 billion, even at expiration date. When they make it, there's 100 billion. Most products don't even come close to that. So give us a try. Call our office. You can pick it up right here, or we can send it to you for a small shipping fee. All right, we're going to get into our nutrition segment since we are running a little bit late today. How to safeguard your bone health naturally. This is from McCullough.com. If you don't have a computer and printer, we can send a copy of this article out, or anything we talk about on the show. We ask only if you don't have a computer or printer or access to the Internet to save on postage. Otherwise, we're sending out to hundreds of people. You can also visit our Facebook page and download it right off the Facebook page, print it off. American Back Centers Pittsburgh is the Facebook page. You can like our page. We would appreciate that as well when you're there. So getting into the article, osteoporosis is a common problem, affecting an estimated 1 in 10 women worldwide by the age of 60. By the time a woman reaches the age of 80, she has a 2 in 5 chance of developing osteoporosis. And most people, sometime during your 30s, your bone mass starts to gradually decline. So that's why I tell people before the age, and it's hard to tell a teenager or a 20-year-old this, but before the age of 30, 35, you should be doing everything you can to avoid, number one, diminishing the calcium, so not drinking the soda pop, a tremendous amount of coffee, caffeine, which depletes the body of calcium. Inflammatory diet does the same thing, depletes the body and the bones of calcium. Birth control pills, as well as smoking, does the same thing. But sometimes it's hard to tell a 20-year-old that. But again, sometime during your 30s, your bone mass starts to gradually decline. For women, that bone loss can significantly speed up during the first decade of menopause, because we're not producing estrogen, of course. Estrogen binds calcium to the bones. Stats suggest that worldwide 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporotic-related bone fracture. In the year 2000, there were 9 million osteoporotic fractures, including 1.6 million hip fractures, a quarter of which occurred in men, which can lead to a significant decline in health and quality of life. Hip fractures can also be life-threatening. 20% of those who break a hip die in their first 12 months following the fracture. Stats also revealed that osteoporosis is becoming more prevalent. In the decade between 1990 and 2000, the number of hip fractures increased by 25% worldwide. So what can be done about this problem is the question. It's important to realize that osteoporosis is preventable by proper living, meaning eating right, your diet, and getting nutritional movement and effective exercise. Weight-bearing exercises are particularly important in prevention of osteoporosis, which is characterized by porous and fragile bones, osteoporosis. Unfortunately, drugs are typically the first-line remedy recommended by conventional doctors. This is tragic. This is Dr. McCullough saying, and I agree as well. This is tragic, considering these drugs do more harm than good. The next paragraph, the case against osteoporotic drugs. For example, oral osteoporotic drugs such as Boniva and Fosamax are associated with a twofold increased risk of esophageal cancer. Research also shows that over time, these kinds of drugs can actually worsen your condition. We're talking about your osteoporosis, not just the esophageal cancer. Because all you're doing is fooling your body into producing denser but weaker bone. So when it forms a bone, it's actually forming bone, but it's weaker bone. This may sound like an oxymoron, but here's how it works. Healthy bones maintain strength from a continual process of bone breakdown and bone rebuilding. Osteoclasts are the cells that break down the bone. Osteoblasts are the bones that build it. Healthy bone undergo a dynamic process of removal of unhealthy bone and replacement with new bone. And you see that a lot in your 20s and 30s. This is how they remain strong. In osteoporosis, the net rate of bone reabsorption or breakdown exceeds the rate of bone formation. And unfortunately, we start to see this naturally as early as age 30. And that's why we tell you to do so much to avoid this prior to the age of 30, but most people don't listen, which results in a decrease in bone mass. These drugs do not actually help your body build new bone. These drugs work by killing off the osteoclasts. Remember, the osteoclasts break down the bone, which halts the normal bone repair process since you now lack the cells that break bone down. So you're just building up bone, you're not building quality bone. The end result is increased bone density, but the denser bone is not stronger. It's very fragile and weak. Eventually, your bones become weaker and more prone to fracture. In women that have been taking these drugs for 5 or more years, the bones have literally lost their ability to regenerate, and this is why so many are still faced with brittle bones and fractures. Next paragraph, your lifestyle largely determines your osteoporosis risk. While diet certainly plays an important role, weight-bearing exercise is one of the most important remedies against osteoporosis. For example, a walking lunge. A lunge is a great exercise for building bone density in your hips. And you can get between 2 chairs for safety and stability, especially if you're unstable. Hold on to the chairs and lunge down, and eventually let go of the chairs as you become more balanced. And you do this without any additional weights, especially in the beginning. This is an absolutely extraordinary exercise and doesn't cost you anything to do. Balance building exercises such as yoga and Tai Chi are also recommended. Of course, as we get older, we start to lose balance, and balance is extremely important to help prevent falls. As long as you have strong muscles, bones, steady balance, your risk of falling is minimized. Should you fall, your chances of actually breaking a bone is also dramatically reduced through weight-bearing exercise and balance exercise training. Nevertheless, to say, the earlier you start exercising, the better, provided you keep it up and you keep doing it. And that's very important. I tell my patients that as well. When they leave here with the vaccine, we give them core exercises to do to keep their core strong. They don't have to do them every day, I tell them, but just maintain and keep your core strong so you don't have to be dependent on an artificial back brace. Your condition is a permanent correction. You want to make sure that you keep the muscle structure strong. Once we take care of the disc problem, that's why we don't do therapy in the beginning, because in many cases strengthening the core is not going to do anything to correct the structural cause of the problem, which is the compressed disc, and the disc pushing on the nerve causing stenosis or pain. You got to take care of the disc first. In many cases, when you do the exercises, you just aggravate the disc. But once things are taken care of with the disc, with VAX-D, then we institute the rehab program levels 1 through 3, and the patient continues doing the exercises, not every day, on their own at home, indefinitely, and that helps them maintain their core strength, keeping that natural back brace to protect their back so these conditions don't creep back. And patients see the permanent correction when they do and follow our programs. It's important. Same thing with this. Make sure you're doing your exercise, weight-bearing exercises, so you can help prevent the effects that you see of aging, namely osteoporosis and bone loss. Exercise naturally builds stronger bones. High-impact exercises such as sprinting and jumping are effective. Walking lunges, as we mentioned, are also effective. Dancing, high-impact aerobics, hiking, jumping rope, climbing stairs, playing tennis. Lower-impact weight-bearing exercises, if you want a safer alternative, if you are frail, include low-impact aerobics, walking, fast walking, I should say, stair-step machines, elliptical machines, those type of weight-bearing activities. Similarly, in lieu of weights, you can just use your body weight exercise bands, elastic exercise bands, functional movements such as raising and lowering your body onto your tippy toes. 3 other exercise alternatives worth mentioning for those who are severely obese, old, or frail include other activities such as walking. Now, walking in the water, I recommend to my patients that have hip issues, knee replacements, disc problems, because it doesn't put the compression on the spine. But you do need some weight-bearing exercise as well for building stronger bones, so that should be noted as well. Whole body vibration training. We offer right here at the American Back Centers. The whole vibration therapy has been proven to increase bone density, as well as balance training and increasing your balance as well. You can actually do squats. You can do different exercises on the whole body vibration therapy as well. Significant increase in bone density when using the whole body vibration therapy on a regular basis. And we offer this using a power plate therapy right here at the American Back Center. So if you want to try the whole body vibration therapy, give us a call. We offer it right here at the American Back Centers. Blood restriction training, also minimizing risk, another technique to try. Excellent in the elderly, athletes recovering from injury. Blood flow restriction. Cat-2 training, talking about how that works. He talks about it in his article here. We don't have time to go over all of this, but if you copy the article or download it, you can read about the Cat-2 training, blood restriction training. Nitric oxide dumping as well, talking about the high-intensity interval training. It's a great way to nitric oxide dump. Great exercise for aging muscles. So doing, if you can, the high-intensity interval training, which we touch on this show many, many times, a great way to dump that nitric oxide out of the body and can benefit your health. The release of nitric oxide, we're not saying jumping out of the body per se, but triggering the release of nitric oxide, a gas with antioxidant properties that protects the heart by relaxing your blood vessels and lowering your blood pressure. We have a great product called L-Arginine Complete that actually increases nitric oxide production in the body. You can do it naturally by doing high-intensity training as well. So, all right, I just got the beep. It looks like we're short on time, so we won't have time to finish this article today, but we will try to finish it in the next few weeks. And also we're going to be touching on the number of people suffering from osteoarthritis, why it has doubled. So we're going to be talking about osteoporosis, finishing that up in a few weeks, as well as the issue of osteoarthritis. Very important topics in today's society. We'll definitely be touching on that in the next few weeks on BackTalk, so definitely stay tuned for that. All right, we are short on time, so I want to thank everyone for listening today. Remember, do your homework before pursuing any treatment option. Ask for the research. Go on the Internet. Unfortunately, there's many people out there making a lot of claims and, quite frankly, scamming you in many cases, trying to make you believe that they have something similar to what we have here with VAXD therapy. VAXD has a proven track record. It's a time-tested treatment, very well-researched treatment, used in over 300 facilities worldwide. 3,000 patients a day are being treated with VAXD. VAXD is accepted by all fields of healthcare, and most importantly, it's something that actually works. With VAXD, the results speak for themselves. We can say that over and over because it is the truth. We've been doing it for over 20 years here at the American Back Centers, helping people avoid back surgery and the possible complications resulting with back surgery and even neck surgery with the neck surgical procedures. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of Back Talk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.